So you've been diagnosed with urinary retention. Here's what you need to know and a bit of what you might like to know. So urinary retention is actually pretty common in older men who have a large prostate. The problem is that the prostate wraps around the urethra, which is the tube that leads from the bladder out the penis to the outside world. Unfortunately, sometimes it compresses it, and even worse, many men get a urinary tract infection. That causes inflammation of the urethra. So along with inflammation and the large prostate, things get completely blocked off, and now no urine can come out at all. So men come in often with 8, 9, 10, even more hours of not being able to urinate. It can be a bit of a vicious cycle because they often have that urinary tract infection as well. So if you're given antibiotics, make sure you take them as soon as you can get them filled and fill the whole prescription. Don't stop early if your symptoms resolve. Now, if you were completely unable to pee, you were probably given a catheter. They inserted this long catheter into the penis to allow you to pass all of that urine. The catheter usually stays in from 1 to 2 weeks. Many patients are very surprised by that. But if you take it out early, it's likely just to re-obstruct, and you're going to have the whole problem all over again, have to come back to the emergency room, and we have to put that catheter back in again, which can be uncomfortable. So it does stay in for about 1 to 2 weeks. Now, Ryan here is going to show you how to manage the leg bag, which you need to attach to the catheter to take it home.
Hi, I'm Ryan, one of the nurses working with Dr. Atzema, and I'm going to show you how to take care of a leg bag. So the catheter has already been inserted while you're in the emergency room. You want to make sure that when you're putting the bag onto it, that there is much slack and it is not tight. If it is tight and it gets pulled, it will be quite uncomfortable. The catheter itself goes into the bag here. Now, you want to make sure as well that this does not become disconnected, as bacteria can get into the catheter, travel back up through the catheter, and give you a urinary tract infection. When it comes to actually connecting the bag itself, you'll see this elastic here with multiple slits and a blue button. What you do is you wrap around the leg, and the blue button goes into one of these slits. You do the same for the bottom as well. Again, making sure you still have slack on the catheter, it is not tight. When it comes to draining the bag, this valve here twists open, allowing the urine to escape. You can take the elastics off and hold it over the toilet, or you can leave it on if that's more comfortable for you. And after you're done draining, you want to make sure to close this valve so there's no leaking, and you want to wipe it with an alcohol swab.
Now, if you take the catheter out earlier, as I said, it may re-obstruct. Even worse, never ever try and pull the catheter out yourself. It has a balloon on the end of the tip, and you will cause severe damage if you try and pull it out yourself. So instead, you'll be seeing your family doctor or perhaps a urologist in 1 to 2 weeks, and they will take it out at that time and see if you can urinate at that time. Most likely, you will be able to. Reasons to return to the emergency room include a blockage of the catheter. In other words, no more urine is coming out into the leg bag that you have. If there's leakage of urine or blood around the catheter at the tip of the penis. If you develop a new fever, that would be 38.0 degrees if you're working in Celsius, or 100.4 if you're working in Fahrenheit. If you develop new upper back pain, this is where our kidneys live, right up here, so around the bottom of the ribs, not lower back, but new upper back pain, that's another reason to come back to the emergency room. And of course, if the catheter falls out and you cannot urinate at all, then you need to come back to the emergency room. I'm Dr. Atzema, and those are my discharge instructions for urinary retention.